This is a very happy day for me. One of my oldest and dearest friends here in the Congress, John Tanner of the 8th District of Tennessee, all the way from Memphis to Nashville, from the little town of Union City, is here with me today. He's a very distinguished member of the Ways and Means Committee, the Money Committee, and president of the International Parliamentary Association and NATO, the North Atlantic Treaty Organization. Many years of service in that. We worked together first on the Armed Services Committee, and now John, as I said, is on Ways and Means. That means he is a member making a lot of the decisions, the major decisions about financing of healthcare and healthcare reform. And I thought it would be very appropriate for him to come today because he's also a member of what you've heard about, the Blue Dog Coalition. And I like to think of myself, John, as a deputy dog.
Well, we're glad to so say.
Yeah.
Thank you.
In more than one occasion. And so I wanted to go into some of the issues that we're trying to deal with in healthcare reform, which I think are universal, just as we want universal health care. We want to hold the insurance companies accountable. We want to make sure that the insurance companies are not between you and your doctor. You hear a lot of propaganda out there now from people who want to stop the whole issue of healthcare reform moving forward, talking about the government being involved, like it is with Medicare or with the Veterans Administration. So we already have that. The question is then, are we going to have pre-existing conditions prevail? A lot of that we've already dealt with in Hawaii. No dropping of your coverage if you get sick. We don't want you to be diagnosed with breast cancer, for example, and be told, well, we can diagnose it, but we can't fix it, or we can't treat it. No more loss of health care based on the loss of a job. No need to change doctors or plans. All these kinds of things are the principles we're dealing with. But what John and I then are going to talk about today, how do you transpose and translate that into actual legislative action? How do you make those principles, those ideas, those proposals and goals into a legislative package that can pass? And John, as a member of the Blue Dogs, you've been getting a lot of the publicity, not you necessarily personally, but the Blue Dogs as a coalition of members, principally from districts that have a great many independents or are Republican leaning, or in fact were Republican districts before Democrats won them. So that's where our working majority in the House comes from, and that's where the difficulty is in trying to put a bill together.
Well, it is. Let me say at the top of your show how delighted I am to be with you. As you said, Neil and I have been friends and colleagues, I guess, 20 years now, and I tell you, I speak for all of the members who know you that we hate to see you go on back home next year, but it'll be Hawaii's gain, our loss.
Thank you very much, John.
I really mean that. Neil has been one of the most thoughtful, valuable members of the House since the time we've been here together. I want to, if I could, just start back to the beginning. We didn't just wake up one morning and say, hey, that'd be a good idea to reform the healthcare system, wouldn't it? What a fun thing to do. We have to do it. The public purse is being depleted. We're going broke because Medicare, Medicaid, all of the healthcare costs for private and public alike has outpaced inflation for now 25, 30 years. So what we're doing is we're trying to do long-term cost containment to at least bring the rise of medical costs in to line with inflation. But beyond that, also do something for people who buy health insurance in terms of bringing universal coverage, which will lower everyone's premium. No matter whether you buy a public plan, private plan, doesn't matter. All premiums should go down if we can get it right. Your question was, how do you translate good ideas into legislation when you have people from a rural southern district to an urban northern district? I mean, the Democratic caucus in the House, as you and I know, goes across the political spectrum of ideology in our country. A little different than the Republican conference. They're more homogeneous. We have the whole bit. So if we can get it right, and we can get a consensus in the Democratic caucus, more than likely that would be acceptable, in my view, to the country.
Would you say that some of the opposition that's coming now goes around the idea of saying to people, you know something, if they pass this health care plan, it's going to do something to you rather than something for you? And what we're trying to do, are we not, is something for people and not to them.
For everybody. This can be done if we get it right. As the President said, if we can control long-term cost, if we can spread the risk and give people who do not have coverage now coverage, if we can then do something about the unbelievable complexity of the system, where doctors, providers, patients, they don't know exactly what they've got, what's covered, what's not covered. You have a pre-existing injury, you had that before, you've reached your deductible, you hadn't reached your deductible. I mean, if we can simplify it and cover people regardless of whether they have a pre-existing, those are the ones that need coverage. Mm-hmm. If they're not sick, you don't really need it this year. You might need it next year.
Isn't that one of the issues that's involved right now? That if we don't have this kind of coverage, insurance will naturally try to seek out those who don't need it. They'll go to the actuarial tables and say, well, if you're young, if you don't smoke, if you're not drinking, some of these indices for health, that's who they want to go in and get. And so naturally, if you're older, you're going to be paying a different premium, or you won't be able to get in to a good health care package, particularly if you, say, lose your job, which has happened in this recession. You go to another job and you're older, middle-aged or older, you're going to have a heck of a tough time getting covered, let alone being able to pay for it.
Exactly. The goal of what we're trying to do here, and it would be, quite frankly, nice if we could get some help. This is not easy. This is very complicated. But the goal is give people stability. You have your health insurance, no matter what happens to you or no matter if you're sick. That is a great peace of mind for people. People say we don't want the government involved in our insurance. Medicare. Were it not for Medicare, 95% plus of the senior citizens in this country would be one major illness and hospitalization, stay away from losing everything they have. Now, we don't want to live in that kind of country.
Aren't bankruptcies a lot to do with health care costs today?
They say over half are due to medical cost. I mean, we don't want to live in, I don't want to live in a country like that, and I don't think most people do. I don't want to live in a country where a 5-year-old child with leukemia can't get treatment because their parents don't have any health insurance. We're better people than that, and we can do this, but it's hard work, and people have to be considerate of another's viewpoint, and we need, quite frankly, the Republicans to help us rather than just throw rocks.